Why athletes need pelvic alignment, improve performance, movement, and reduce fatigue. Presented by Dr. Masood Shamaizadeh, Soft Touch Chiropractic, Porter Ranch, CA. Whether you run, lift weights, play tennis, golf, cycle, hike, or compete in organized sports, your performance depends on more than strong muscles. How efficiently your body moves matters. At the center of that movement is the pelvis, the structural connection between your spine and lower extremities. When pelvic and hip mechanics are functioning efficiently, forces can be transferred through the body more effectively. When movement becomes uneven, other areas may have to compensate. For athletes, these compensations may contribute to muscle tightness, inefficient movement, low back or hip discomfort, and earlier fatigue. The pelvis is the center of your kinetic chain. The pelvis connects the spine, hips, legs, and core muscles. Running, jumping, kicking, rotating, lifting, and changing direction all require coordinated movement through this region. Research on sacroiliac joint dysfunction in athletes, please open your app to see this link, describes the SI joint as a potential source of low back pain in athletes and discusses the importance of proper diagnosis and management. Research has also examined the relationship between pelvic asymmetry and trunk movement. Please open your app to see this link. Importantly, pelvic asymmetry alone does not necessarily mean that an athlete has pain or dysfunction. The goal is not simply to make the body look perfectly symmetrical. The goal is to determine whether an imbalance is interfering with normal movement and function. What happens when the pelvis and hips are not moving efficiently? Imagine running with one shoe slightly different from the other. You can still run, but your body has to compensate. A similar principle may occur when there is a functional imbalance involving the pelvis, hips, muscles, or sacroiliac joints. The body may compensate through the lower back, hip muscles, hamstrings, quadriceps, knees, ankles and feet, core and trunk muscles. Over hundreds or thousands of athletic repetitions, small movement inefficiencies can become increasingly important. A systematic review of rowing biomechanics and low back pain. Please open your app to see this link. Examine differences involving pelvic position, hip movement, lumbar mechanics, muscle activity, and fatigue in athletes. Pelvic balance, movement and athletic fatigue. Athletes usually think of fatigue as a conditioning problem, but fatigue can also change how an athlete moves. When muscles become tired, technique and movement patterns may change. A British Journal of Sports Medicine consensus statement, please open your app to see this link, discusses how fatigue and technique can influence lumbar and hip mechanics in rowers. This creates an important concept: poor mechanics, compensation, increased muscular demand, fatigue, further changes in mechanics. This does not mean that every tired athlete has a pelvic alignment problem. However, when an athlete repeatedly experiences one-sided tightness, recurring low back discomfort, hip restriction, uneven movement, or unusual fatigue, biomechanics deserve attention. What about an apparent short leg? Sometimes one leg appears shorter even when there is no major difference in the actual length of the leg bones. This may be described as a functional or apparent leg length difference. Pelvic position, hip mechanics, muscle imbalance, joint restriction, posture, and weight-bearing patterns may influence how the legs appear and function. For an athlete, the important question isn't simply, is one leg shorter? A better question is there a functional imbalance affecting the way this athlete moves? Signs an athlete may benefit from a biomechanical evaluation. Consider an evaluation if you repeatedly notice one hip feeling tighter than the other, recurring low back pain or stiffness, uneven weight distribution, one side hamstring or quadriceps tightness, difficulty rotating equally in both directions, uneven running or walking mechanics, recurring hip or lower extremity problems, decreased mobility as straining progresses, feeling that one side works harder, unusual fatigue during repetitive activity. These findings do not automatically prove pelvic misalignment. They are reasons to examine the entire kinetic chain and determine what may be contributing to the problem. Chiropractic care for athletes in Porter Ranch. At Soft Touch Chiropractic, Porter Ranch, CA, our approach is not simply to ask, where does it hurt? We also look at how the body is functioning and moving. An athletic evaluation may include examination of pelvic mechanics, spinal movement, hip mobility, muscle balance, apparent leg length, posture, flexibility, Gait, functional movement. When clinically appropriate, chiropractic care may be combined with mobility work, stretching, strengthening, therapeutic exercise, soft tissue techniques, and recommendations for improving movement patterns. The objective is not to promise that a chiropractic adjustment will automatically make someone faster or stronger. The objective is to identify mechanical restrictions and movement problems that may be preventing the athlete from moving as efficiently and comfortably as possible. Better movement can support better athletic performance. Athletic performance depends on many factors: strength, mobility, coordination, technique, plus conditioning, plus recovery, plus efficient biomechanics. Pelvic and spinal mechanics are important pieces of that larger picture. Sports medicine increasingly recognizes that athletic injury and performance cannot be reduced to one measurement or one asymmetry. Training load, fatigue, biomechanics, previous injury, conditioning, and recovery all interact. This is why athletes should be evaluated as a complete moving system, rather than focusing only on the location where pain happens to appear. Don't wait until pain stops your training. Pain is often what finally brings an athlete into the office, but changes in movement may occur before a problem becomes severe. If you repeatedly experience low back pain, hip tightness, uneven movement, apparent short leg posture, or recurring muscle fatigue, consider having your biomechanics evaluated. At Soft Touch Chiropractic in Porter Ranch, we evaluate the spine, pelvis, hips, muscles, posture, and movement patterns to help determine whether a mechanical problem may be contributing to your symptoms. Schedule an athletic and pelvic evaluation. Soft Touch Chiropractic, Porter Ranch, CA. Dr. Masood Shamezadeh. If you are an athlete looking for a chiropractor in Porter Ranch or want to have your pelvic and spinal biomechanics evaluated, contact Soft Touch Chiropractic. Your body doesn't have to be perfectly symmetrical to perform well, but efficient, coordinated movement matters. Research and reputable sources. For readers interested in learning more, sacroiliac joint dysfunction in the athlete, diagnosis and management, PubMed. Please open your app to see this link. Rowing-related low back pain and biomechanics, a systematic review. PubMed's open your app to see this link. Low back pain in athletes, biomechanics, fatigue and prevention. British Journal of Sports Medicine. Please open your app to see this link. Pelvic asymmetry and trunk movement. PubMed. Please open your app to see this link. Pelvic asymmetry and low back pain research. PubMed. Please open your app to see this link.